Hi, you guys. Welcome back to UWorld's Next Gen NCLEX review. We're so glad to have you guys here for our next question drill session. We hope you were able to join us yesterday for our maternal health topic, but what you guys can expect today is we're going to run through 10 questions. So I'm going to read the question for you guys, give you about 30 seconds to answer, and then we'll talk about why the question or the option choice is right. So we're going to kind of be very, like we call these drills for a reason. We're going to just be very structured in our time together today. I'll be checking the chat. Make sure you guys engage in that. To all of our friends on TikTok, make sure you share this session. The more the merrier. We hope that we can get to as many nursing students as possible as you guys are in this crunch time preparing for your NCLEX. So we're glad you guys are here. I think we're going to go ahead and just get started, but as always, we have our content experts moderating the chat. So if you have any questions, feel free to let us know and we will do our best to get to all of them. So with that being said, let's kick it off. Let's get started. All right, so again, we are doing maternal health questions. We're going to do 10 of them, and we're going to walk through them together. So engage with us in the chat, and we'll get started. All right, question 1. I'll read it and then give you guys some time to answer, and we'll go through it. All right, the nurse is caring for assigned postpartum clients. The nurse should first assess the client who... Option 1 is rating incisional pain as 7 on a scale of 0 to 10. Option 2 is reporting pain with urination 3 days after cesarean birth. Option 3 has a boggy uterus and is passing a large amount of lochia rubra. Option 4 has warmth and erythema of the right breast and a crack on the nipple. So I will give you guys 30 seconds. Put your answers in the chat. I'm going to see who's joining us here today. Good answers coming in from YouTube. Good job, you guys. A lot of right answers. And let's see, where's everyone joining us from today? Good to see you guys. A lot of hellos. A lot of different, like, afternoons, evenings, so that must mean we have people joining us from all around the world. So glad to have y'all here. And also, too, let us know if you guys have taken your NCLEX or when you're testing. We'd love to see that stuff, too. Okay, a ton of right answers. Good job, everyone on Instagram and YouTube and TikTok. And I saw a question on here too. We will have these in all of our live sessions. They're available on Facebook and YouTube on demand. So we have tons of great resources, a lot of big topics that we're covering for you guys kind of in advance of the NCLEX for those of you that just graduated nursing school. Okay, so a ton of right answers. I'm going to go ahead and pull up the right answer. So our correct answer is option 3, has a boggy uterus and is passing a large amount of lochia. So again, when we see in that stem first bolded, that means we need to think about what's most important. And we always think about our ABC, so airway, breathing, circulation. In this situation, we're worried about circulation and blood. And then again, we're looking for options that are expected versus complications. But for this question and this topic specifically, lochia rubra is bright red blood, and it's expected to last at least like 3 to 4 days following delivery, but that amount should be decreasing. So a client with a boggy uterus, meaning it's like not contracting, and large amounts of bright red blood, they're at risk for secondary postpartum hemorrhage, and they should be assessed immediately. So what we can expect to do as a nurse in these situations is encourage the client to empty their bladder. This is going to allow that uterus to contract, and then also performing fundal massage, so kind of stimulating the uterus to contract again. So good job, you guys. This is amazing. You guys, I think I saw like pretty much 100% correct on that, so well done. Okay, moving on to question 2. As always, I will read this and we'll go through, give you guys some time to answer. In case anyone's new joining us, we are going through maternal health questions, and we are on question 2 of 10. All right. The nurse is reviewing new prescriptions for a client who is scheduled for induction of labor. The client has a history of previous cesarean birth and a positive test result for Group B streptococcus. Which of the following prescriptions should the nurse clarify? Option 1, oxytocin. Option 2, ampicillin. Option 3, misoprostol. Option 4, nalbuphine hydrochloride. All All right, I've got my time ticking. Let's see what you guys think. This one's a little bit trickier. Let's see what we're getting. Good job, you guys. All right, I'm seeing some answers come in on YouTube and Facebook. This one's tricky. I'm seeing some people getting a little bit confused. So we'll take a little bit more time and walk through this one. But all right, good job to everyone on Instagram coming through. Good job, YouTube and Facebook. Good work, you guys. Okay, if you have any, I'll give you guys a few more seconds, see some more answers come through. A lot of great answers coming in right now on good job, everyone on YouTube. I'm seeing a lot of good ones. Awesome. Okay, so we will pull up our correct answer. So our correct answer is option 3, misoprostol. So this is what the nurse should clarify. Again, a strategy to help you with these clarify questions. Clarify means that your answer is going to be the option that's not safe. So the safety of the client would be impaired. And then for the questions like this too, we're going to look for options that are indicated versus contraindicated. So definitely not safe. So for this one, misoprostol is a cervical ripening agent, and it's used before the onset of labor. So what cervical ripening agents do is they soften the cervix so it can become more pliable, allowing for dilation and effacement to occur a lot easier during contractions. So not only is misoprostol used for cervical ripening, but it's also a prostaglandin, which means it's going to stimulate frequent contractions. So due to like these two factors of how misoprostol works, misoprostol is going to be contraindicated in clients that have uterine tachysystole or clients with a previous cesarean birth, because this can increase the risk of uterine rupture. And this can be fatal to both the maternal and the fetal client. So this is an absolute contraindication in a client who's had a cesarean birth. Now, I saw a lot of you guys got held up on option 1, oxytocin. The difference between the two, oxytocin can be used to stimulate or induce labor, but it's an IV medication. So we can discontinue it, we can turn it down, but misoprostol, once you give it, you can't take it back. And because of how it works, it places the client at increased risk for that uterine rupture. So it's definitely a contraindication. So hope that was helpful. Thanks to anyone on TikTok who's sharing our video. The more the merrier. We still have 8 questions left to do, so thanks, guys. All right, moving on to question 3. The nurse is planning care for a client who is pregnant and has severe preeclampsia. Which of the following interventions should the nurse include in the client's plan of care? Select all that apply. Option 1, administer labetalol. Option 2, administer carboprost. Option 3, check deep tendon reflexes. Option 4, administer magnesium sulfate. Option 5, minimize environmental stimuli. So I will give you guys a little bit longer since this is a select all that apply. Again, when you see select all that apply, that means you're going to have more than one right answer. And well, I won't give you the tip because that's next, but you guys know what to do. Okay, let's see what y'all think. Good job, everybody. A lot of great answers coming in on YouTube. Let's see how we're doing on TikTok and Instagram. Good job, you guys. All right, this is great. Good work for our select all that applies. Good job on Instagram and Facebook. I'm seeing a lot come in. It's going so fast. I'm trying to see if I can read a name, but my eyes don't move that fast. But all right, I'll give you guys a few more seconds. I'm seeing a bunch come in already now for Instagram. Good work, you guys. Awesome. Okay. Good job, good job. Now they're really flying in. Okay. Well, I think with that being said, I'll go ahead and pull up the right answer. All right. So our correct answers are going to be options 1, 3, 4, and 5. Okay, so preeclampsia is a hypertensive disorder of pregnancy. It's going to occur at or after 20 weeks of gestation, and it's going to look like proteinuria, so protein in the urine, and other or other signs of end organ damage. that can lead to eclampsia or seizures. So expected interventions for these clients with preeclampsia are going to be focused on seizure prevention. So this is going to be focused on our option about administering magnesium sulfate. This is going to dampen an overexcited central nervous system, and then also reducing environmental stimuli. This is going to help prevent seizures. We're also going to want to monitor for signs of impending seizure, which is why we assess for reflexes. So if our client has brisk reflexes, so quick to respond reflexes, that can indicate impending seizure. And then also managing hypertension. That's kind of the root cause of what's going on with preeclampsia. So administering antihypertensives like labetalol is definitely going to help. And labetalol is a safe antihypertensive for clients with that are pregnant. Okay, our option about carboprost, that is a uterotonic medication, and it's given after the client has delivered, so we wouldn't give it to them while they're pregnant. Okay, so again, when we're working through select all that applies, take a true-false approach to these. Go one at a time. Don't get overwhelmed by having an extra option choice. And then again, look for interventions that are going to be anticipated versus not anticipated. All right, good job, you guys. We are now on question 4. I will read it and let y'all answer. Okay, the nurse is screening for clients for those at risk for experiencing preterm birth. The nurse should recognize the client at the highest risk for preterm birth is a client who, option 1, stopped smoking cigarettes 5 years ago. Option 2, had a previous vaginal birth at 38 weeks gestation. Option 3 has a pre-pregnancy BMI of 25 kilograms per meter squared and a single gestation pregnancy. And option 4 started receiving prenatal care in the 3rd trimester and has bacterial vaginosis. All right, so I'll give y'all some time to answer, but I'm seeing a lot of great answers come in already. And thanks to our friends on TikTok who followed us. We hope you guys follow us on whatever your preferred social media channel is. We really appreciate it. We've got lots of great info for you. Good job, everyone on YouTube and Facebook. A ton of great answers coming in. Good job. I'm seeing our Instagram friends come through. Good work. Really good answers. Oh my goodness. You guys are flying. Good work. Thanks to our TikTok friends for following us. And if you want to, go the extra mile. Share this. But good job. Okay. All right. That's our 30 seconds. So I'll pull up the answer. So our correct answer is option 4, started receiving prenatal care in the 3rd trimester and has bacterial vaginosis. So again, when we see highest risk, that a lot of times is going to mean the most risk factors. So our client in option 4 has 2 risk factors, and we'll walk through those. And then again, with all of these, look for what's expected, like what is normal for the situation versus what is going to indicate a complication. So preterm birth, just as a note, is birth before 37 weeks gestation. So again, our client in option 4 has 2 risk factors for preterm birth. So these risk factors include the delayed prenatal care and bacterial vaginosis. So what happens with bacterial vaginosis is we have an overgrowth of our normal vaginal flora. This can cause inflammation, and then that inflammation can cause a premature rupture of membranes, or essentially a premature breakage of our waters. So that's going to be our correct answer. But you guys did really great on that. I saw pretty much just the right answer, so well done. All right, halfway point. Question 5. The nurse has taught a client who is entering the 3rd trimester of pregnancy. Which of the following statements would indicate a correct understanding of the teaching? Select all that apply. Option 1, fetal movement is expected to decrease toward the end of pregnancy. Option 2, lightning makes it easier to breathe but can cause increased bladder pressure. Option 3, spontaneous rupture of membranes can cause a large gush or slow trickle of fluid. Option 4, true labor occurs when regular contractions cause progressive dilation of the cervix. Option 5, blurry vision and severe headache are common discomforts of pregnancy. So we'll give you guys a little longer to answer this one since it's a little bit longer of a question, but let us know what you guys think in the chat. And good job, you guys. We're at our halfway point. It's not too late for anyone to join. And again, this is always on demand on Facebook and YouTube when we're done. So you can go back through and practice. All right, good job. A lot of great answers coming in on YouTube. All right, I'm seeing everything come in on Instagram now. Good job, you guys. Let's see what TikTok is thinking. We'd love to see your answers. Make sure and use that chat. All right. Good work, you guys. Good job on YouTube and Facebook. Here's our Instagram. Good job. All right. I'll give you guys just a few more seconds, and then we'll pull up our right answer. All right, good job, you guys. Okay, and we can spend a little bit more time walking through this one too. I'm seeing mostly right answers, but we'll go through it. Okay, so our correct options are options 2, 3, and 4. So again, with this select all that applies, same rules always apply. Just take it one option at a time. Take a true-false approach, but making it what the STEM is asking. So again, correct understanding is looking for what is safe to do for that client. So for option 2, again, expected findings in the 3rd trimester of pregnancy are going to include understanding that lightening is going to improve breathing, but it's also going to worsen bladder pressure. So what lightening means is just the baby is descending lower into the pelvis. So obviously we're going to be able to breathe better because our lungs are up high, and if the baby's lower, it's going to have less pressure, but we're going to have more pressure on our bladder, so more frequent urination. Also, option 3, spontaneous rupture of membranes. You can either have a big gush or a slow trickle. It just depends. It's going to depend on what's going to happen with your pregnancy. So that is a correct understanding. And then option 4, true labor occurs when regular contractions cause progressive dilation of the cervix. That's exactly what true labor means. So option 1, fetal movement should increase. Our baby's getting more and more active as it's developing. So that would be something alarming that they would want to contact the provider. So that's not expected. And then option 5, blurry vision and severe headache. That could be worrisome for preeclampsia. So again, that's not a normal finding, something that we want our client to recognize is not safe for them or the baby, and they need to take action. All right, good job. Made it past our halfway point. We're going to move on to question 6. So good job, you guys. Thanks to everyone who's following us too. I'm seeing a lot of that come through. You guys are doing awesome. Okay. Option 6, the nurse in the labor and delivery unit is reviewing fetal heart patterns for multiple clients. Which of the following patterns would be a priority to follow up? Option 1, moderate variability with no accelerations. Option 2, minimal variability with a baseline rate of 115 per minute after receiving zolpidem. Option 3, minimum variability with recurrent late decelerations. Option 4, moderate variability with a baseline rate of 155 per minute after receiving penicillin. So, all right, I'll give y'all some time. Let's see. I'm seeing a lot of good answers come in. Thanks to anyone who's sharing us and following us. We really appreciate it. Good job. Answers coming in on YouTube. I'm waiting for our Instagrammers to come through. Let's see what y'all think. Good job. Here they come. Good job on Instagram. All right. Good work on YouTube and Facebook. Good job, you guys. Here come our Instagrammers. Good job. Let's see what TikTok thinks. Make sure you use that chat. Let us know. Good answers, everybody. Okay. All right. So our time's up. I'll move on to our answer. So our correct answer is option 3. Again, in this, I'll read it. Option 3, minimum variability with recurrent late deceleration. So again, priority to follow-up means it's the most important. So again, think ABCs. This is no different when we're thinking about a fetal client. All of that applies to us. And then again, look for options that are expected. So what you would expect to see on a fetal heart strip versus what is indicating a complication. So minimal variability with recurrent late decelerations. These are non-reassuring fetal heart patterns, and they're going to indicate that the fetal client is not receiving enough oxygen. And they're going to require interventions such as changing the maternal position, applying oxygen to the maternal client. And again, if we don't take intervention with these clients, the fetal client is at risk for hypoxia and acidemia. So again, that acidic buildup in their blood. So other findings, these are all normal, what you would expect in a normal assuring fetal heart strip. So very good job, guys. Good work. All right, let's move on to question 7. I will read it, give you all a chance to answer. We're in the home stretch, and again, this will be on demand. You guys can go through and practice it if there's anything you need to go back and kind of get better understanding of. Okay, the nurse is observing staff members administering medications to assigned clients. The nurse should intervene if a staff member is observed administering option 1, penicillin to a client who is in labor and has not been screened for GBS. Option 2, magnesium sulfate to a client who is experiencing preterm labor. Option 3, terbutaline to a client who has uncontrolled gestational diabetes. Option 4, hydralazine to a client who has preeclampsia. All right, I'll give y'all 30 seconds to answer. Let's see what you think. I'm seeing some mixed answers come in already, so we can also walk through this one a little bit more. But good job, everyone. All right. Good job, you guys. Instagram coming in. YouTube coming in. Good job, good job. All right, good work. This one I'm seeing, this one's tricky. Okay, we'll walk through this one a little bit more. But you guys were doing so good. Not that we want to stump you, but I do feel like now you'll learn something new if you, since you guys are doing so good on everything, that you really had those topics mastered. All right, good job on YouTube. Let's see, Facebook coming in. Good job, you guys. All right, Instagram. Okie dokie. All right, so we'll pull up our answer. So our correct answer is option 3, terbutaline. So again, intervene is going to mean that your option is not going to be safe for the client again. So we need to look for options that are indicated versus contraindicated. So terbutaline is a beta agonist medication, and it's used to help prevent or slow uterine contractions. So terbutaline is not indicated in clients with gestational diabetes because it can worsen the diabetes. It can elevate our blood sugar, and it can put clients at risk for ketoacidosis. And again, we have uncontrolled in here. So these clients are going to be most at risk for very severe complications. So in option 1, we give this prophylactically. A lot of you guys had put that as your option. We're gonna, if they haven't been screened, we need to give it prophylactically to our client. And then option 2, magnesium is given during preterm labor as a for fetal neuroprotection. And then option 4, hydralazine is an appropriate medication to give for blood pressure control and preeclampsia. All right, so moving on, question 8. Okay, the nurse is reviewing new medication prescriptions for a client at 29 weeks gestation who is experiencing preterm labor. The nurse should clarify the prescription for option 1, magnesium sulfate, option 2, betamethasone, option 3, indomethacin, option 4, doxycycline. So I got my time, and we will see what y'all think. Let us know what y'all think. Good job, everybody. Thanks to anyone following us and sharing our video. We appreciate it. Good job on YouTube. I'm seeing a bunch of good answers come through. All right, good work, you guys. I have about 10 more seconds, and then we'll pull up the right answer. I'll wait for my Instagrammers to come through. Here they come. Good job, you guys. A lot of good answers, good right answers. Good job on Facebook, YouTube, TikTok. Let's see where you guys are on TikTok. Good job. All right. Good work, you guys. Awesome. Okay, we'll pull up the right answer. So doxycycline is our correct answer. The nurse should clarify a prescription for doxycycline. So again, clarify means the answer option is not safe. So it's not safe for our client to have. We're going to look for medications that are indicated versus contraindicated. And again, our client is in kind of a state of preterm labor. So what would we expect to give versus preterm labor versus what's contraindicated? What is not going to be safe for that client? So doxycycline is a tetracycline antibiotic, and it's not safe to be used during pregnancy. So the medication can pass through the placenta and cause fetal harm. So side effects of this are going to be, to the fetal client, are going to be like a regular development of teeth and bone. So that's why we don't want to give it. It's definitely contraindicated. All right, we're almost there. Question 9. Okay. The nurse is assessing a client with suspected placental abruption. Which of the following findings would support a diagnosis of placental abruption? Option 1, painless bright red vaginal bleeding. Option 2, rigid board-like abdomen. Option 3, referred shoulder pain. Option 4, uterine atony. Let's see what y'all think. Good job, everybody. Hang in there. We're in the home stretch. One more question. All right, let's see how we're doing. Good job, everybody. I'm seeing a lot of right answers come through. And before we're done, let us know if you guys like this kind of live session. We love to hear, we're trying all sorts of new and different things. So if this is clicking with you, if it's helpful, if you're learning a lot this way, let us know. We love to hear it. We want to make sure that we're doing the most to help you guys as you're getting ready for your NCLEX. And I think everyone's probably wrapped up nursing school at this point. But all right, let's see what y'all think. Well, thanks for someone saying you love it. That's good. Glad we're helping. All right. Good work. Okay. Give you guys just a handful more seconds. I saw our Instagram people come through. Good work. All right. Thanks for the good feedback too. Glad it's helpful. Okay. Our correct answer is option 2, rigid board-like abdomen. All right, so again, when we're looking about, or when these questions are asking us what we would see kind of patho-related questions, think about, as we've always talked in our kind of content lives, what is the big picture complication? What are we most concerned about in these clients? And that can really key you into your correct option. So in this situation, option 2, rigid board-like abdomen, is what we're really most concerned about and what indicates a major complication of placental abruption. So placental abruption occurs when the placenta prematurely detaches from the uterine wall. So this is life-threatening to both this can be life-threatening to the mom and to the fetal client. So it can interrupt fetal oxygen supply and it can cause maternal hemorrhage. So manifestations of this are going to be sudden onset bleeding and an acute increase of intrauterine pressure. It's going to result in severe abdominal pain, uterine irritability, which means like extremely high frequent contractions, and a tender, firm uterus. So that rigid board-like abdomen is going to indicate we have hemorrhage in the abdomen. All right, so I'll walk through some of these a little bit more too so you guys know, because I saw a lot of mixed answers. But option 1 is indicative of placenta previa, which is when the placenta is covering the cervix. Also, an important thing to know, but this question is asking us about placental abruption. Option 3, referred shoulder pain. This is typically associated with a ruptured ectopic pregnancy. And then option 4, uterine atony. This is a cause of postpartum hemorrhage, but again, not placental abruption. Okay, home stretch, question 10 of 10. This one is worth all the points, so if you get it right, you get all the points in 100%. Okay, all right, the nurse is talking with a client who had an uncomplicated vaginal delivery 1 day ago. Which of the following statements by the client would require follow-up? Option 1, I may experience dull headaches for the next week. Option 2, I should perform leg exercises while I am resting in bed. Option 3, I will have pinkish brown vaginal discharge for the next 4 to 10 days. Option 4, I will notify my healthcare provider if I experience sadness or changes in mood for longer than 2 weeks. All right, and I'll look at the time and let y'all answer and let us know. Put your answers in the chat. All right, good job, you guys. Let's see what y'all think. Good answers coming in. Thanks for sticking with us. We are on our last question, then we'll be done. And also, after we answer this question, let us know how many you got right out of 10. I'd love to know how everyone did if you stuck with us for all 10 questions. If you got all 10 right, way to go. Good job. All right, good job. Good answers coming in on YouTube and Facebook. Good work, everyone. I'll let our Instagrammers come through and let us know, too, on TikTok what your answers are. We love to see it. Good job, you guys. Awesome. Good work. Okay. I will pull up the right answer. So the correct option is option 1. Again, when our question says require follow-up, that means look for incorrect statements or statements that are not going to be safe for our client. So persistent headache and blurred vision can indicate postpartum preeclampsia. So again, the majority of our clients with preeclampsia will develop symptoms before birth, but it can also present itself after. So again, this is a serious complication or condition, and it can rapidly worsen, and without treatment, it can lead to seizures or even death. So again, we really want this client to be aware of that and to know they need to take action and call the provider. So I think you guys, for the most part, got that one right. I can walk through, I did see a few mixed answers, but option 2 is all about preventing DVTs. After you deliver a baby, you're in a hypercoagulant state, so we want to do everything we can to prevent any DVTs, sorry. Option 3 is, this is expected. This is called lochia serosa. And then option 4, this is correct. You do want to notify the healthcare provider because this can be indicative of postpartum depression. So this client is saying the right things, that they do need to take action if they're still feeling a little sad after 2 weeks. So good job, you guys. I'm seeing a lot of great passing scores. Good work, everybody. This is not an official grade, but I'd give you all 100 just for joining us today. So thanks for being with us. But that wraps up our maternal question drill. Come back tomorrow. We're going to do newborns. So that's going to give you a really great kind of hopefully full encompassing grasp of a lot of big topics that are covered in maternal and newborn health. Again, we had our content that we covered yesterday. We talked about gestational diabetes, shoulder dystocia, a bunch of other complications, and then APGAR scoring. So again, today we did maternal questions, tomorrow newborn. All of this is on demand on Facebook and YouTube. But most importantly, you guys are in crunch time for your NCLEX. Check out our free 7-day trial on nursing.uworld.com. Get a feel for what UWorld's all about. We have a lot of great NGN style questions on there, case studies, standalone items. Our questions and explanations are really what we're so proud of here at UWorld. We know that's where the learning happens and where the repetition of practicing questions is really going to help you make the most strides as you're preparing for your tests. So we hope these are being helpful for you guys. We really appreciate y'all joining. Again, as always, subscribe and follow us on your favorite channel. We have tons of great resources for you guys, not only on our social media channels, but on our website as well. So we hope you'll come back tomorrow, same time, same place, and we'll see you then. Thanks again. Bye.